Hi, everybody. I am Kelly Carter, the what am I? The manager of school nursing programs, the Oklahoma State Department of Ed. So sorry. Today, speaking with me, I have Beverly Burke. Beverly, would you like to say hi to everybody?
Good morning, all. I'm from Jennings Public Schools, the Health Services Coordinator for a few more weeks here. As I get ready to retire, but I'm welcome you all this morning.
Yeah, we are so appreciate Beverly being here today so we can squeeze a little bit more information out of her before she goes on this awesome vacation that she's going on. So thank you for joining us today. I just want to remind everybody that if you guys are in your offices and you have kids coming in and out where they can be seen on camera, we want to ask that you keep your cameras turned off because we are recording. If you don't have kids coming in and out, and we would love to see your bright, shiny faces. I see a few already, so we're excited to have all of you here. And today we are going to talk about health plans and action plans and all kinds of different stuff and how to create those, what the differences between all of those, and kind of dive down into a little more specifics. So I'm going to go ahead and share my screen. 1 second. Everybody see that okay? Oh, not yet. Maybe if I actually push share, then you can see that. Thumbs up for those that are on camera if you can see that. All right, thank you.
We see it, but it's still preview mode.
Better?
Yeah.
There we go. All right, guys, welcome to another episode of Networking with Nurses. Again, this is a time to learn, connect, and support fellow school nurses. We're going to go through our presentation, and then we'll have time for questions and answers afterwards. We're going to just start out diving in deep, talking about different definitions. I'm going to briefly go over the difference between IEP 504 and IHP. And then Beverly's going to work with us on how to build some action plans and give us some resources. So we all know these words because we hear them every day. So I just wanted to go over that an IEP, which is the individualized health plan, is a plan or a program developed to ensure that a child who has a disability identified under the law and is attending an elementary or secondary education institution level receives specialized instructions and related services. And Beverly, feel free to hop in at any point if you want to add anything to what I'm saying. So IEPs are always focused on education, what accommodations and education specialties that we need to have available to our students. Next is the 504. The 504 plan is a plan to develop to ensure that a child who has a disability identified under the law and is attending an elementary or secondary education institution receives accommodations that will ensure their academic success and access to the learning environment. So when we compare IEPs to 504s, 504s are going to be more accommodations. So that's why a lot of times whenever we have students that it's medical needs and they don't have any educational needs, they're only going to be housed on a 504. So most of our diabetics are on a 504 because we need accommodations for classroom. We need accommodations for state testing. So during state testing, this child needs to be able to take breaks from time to time, depending on blood sugar levels, depending on restroom breaks, snacks, that kind of thing. They also need to have their phone with them at all times, even during state testing. So a 504 accommodates that, what they would need in those classroom settings. Whereas the IEP, like I said, is more educational. So do they need speech therapy? Do they need physical therapy? Do they need to, have seating accommodations and to meet their educational needs? So that goes more onto that. Now, the fun part is all this meshed together. An IEP can also have a 504 built inside of it. So if I have a kid who has a mental health disability and they need classroom accommodations, that's all going to be on the IEP. But on a 504, it is only classroom accommodations. So if I have a student who is needing that educational support, they will not just be on a 504. Beverly, am I making myself clear on that?
Generally, that's the way that our district has always implemented it, and that I've heard is that the IEP can be inclusive if a child's educational needs are impacted by health and other education issues. So we can put it all together, and then that way it decreases the number of meetings and then the number of communications to the parents and all that. But if you have just a child who doesn't have educational accommodations, reading or writing or math or tutoring or all the other things, and doesn't need a para and all those kinds of things, then we can put those strictly on a 504, just to address their academic needs surrounding their health issue. Mm-hmm.
Thank you. Yes, I agree with that completely. So, before we get into health plans, real quick, if anybody has a question or comment on those, we can take a couple of really quick ones. You can throw them in the chat or you can unmute, whichever one you would like to do. All right, we're going to move on to health plans. So keep it going with definitions. A health plan or an individualized health plan or an IHP is a plan that considers how to deal with what might happen with a student medically while the student is in school. It is designed to address medical issues that do not impact the student's learning. So an IHP is a formal agreement that outlines the student's need and a plan for addressing those medical needs. So these health plans are only addressing medical needs that could happen while that child is in school during the day. It is not going to address any educational needs or anything like that. So your diabetics, I always like to use diabetics because most of us have them and are familiar. They're going to be on a 504 if they don't have any educational needs. And we need to build a health plan for them to address those medical issues that are going throughout the day. Beverly, would you like to elaborate on that just a little bit?
Well, yeah, I would say they're going to have a they're going to have a 504 if their educational needs have to be accommodated during that time. Now, sometimes diabetics is a hard one because it gets tricky. And I never like to promote extra work. I never like to. 504s will always come from your SPED department. They don't get initiated from the nurse, but the nurse should be consulted by it. Your IHP is going to be initiated by the nurse to teach the education people what they need to know about the health condition. So I don't. That gets kind of tricky. If you get everything you need, if the education people have initiated this 504, the parents are asking for these accommodations, I don't see why it couldn't all be put together in that document. But not every person goes on a 504 for a health diagnosis. More often you get the diagnosis that comes, and diabetes is a good one, but there's so many more. The spina bifida child that needs to be catheterized during the day, or the student who's going to receive tube feedings during the day. There's going to be other issues that you're going to need to tell the teaching staff about around considering the health of a student than those that would necessarily need a 504. Does that make sense? It is all very, if you don't do it twice. That's the bottom line. If you've got the 504 and that meets your students' needs, then that's great. But if you don't have that, health plan needs to be in place so that you're teaching. And the other thing is that a 504 is really mostly only for the students and the parents and the teachers, where your health plan is going to be related to anyone in your environment. Your health plan is going to be related for your cafeteria workers. It's going to be related for your bus drivers. It's going to be related for, the outside people that might come into the student's day. And this is your opportunity to teach what that student needs to make it through a school day with a health-related issue, diagnoses.
Right. So, So yeah, let's move on to, we're gonna talk about health plans versus action plans. Again, if you guys have questions, you can throw them in the chat and I'll try to address them. And I wanted, someone asked me to clarify one thing real quick. With the IEP and the 504, you can't be on both. You either have an IEP or you have a 504, but the 504 can be built into an IEP. An IEP cannot be built into a 504. I hope that makes sense. It's a little confusing, but that's where it is. Whereas the health plan, again, like Beverly was saying, that is designed to be able to accommodate that student medically during the day. And it's for anybody in the district who it would be in contact with that child throughout the day to meet those needs. Okay. So now we're going to talk about health plans. Again, we've already defined health plans. We're also going to talk about action plans. So we do a lot of like asthma action plans, seizure action plans, allergy action plans, those type of things. So the goal of an action plan is to provide school nurses and administrators with the necessary information to treat a student for the condition that they may have. This includes allergies, diabetes, seizures, and more. So with the action plan, those are the ones that we send out to the physician to basically get physician's orders for our action plan, where the physician signs it, the parent signs it, and the school nurse signs it. And so those are basically, you know, it's like our DMMP. What actions do we need to take for this student whenever they get into those situations where we need to intervene medically? Beverly, would you like to add in more?
Exactly. And more often than not, the action plan is for the nurses. It's a logarithm for the nurse assessment and reaction and treatment of the condition.
Right. And we're going to get into some examples on these next slides, guys. So we just want to define everything first to make sure we're all on the same page. And now we're going to really deep dive into these action plans. But first, let's talk about the NASN position statement. So the National Association of School Nurses, they do have a position statement when it comes to individualized health plans. Because we all know, whereas like IEPs and 504s, those are required in a school district. I think 504s are federally mandated. IEPs, can't remember if those are federal or state. Beverly, do you remember? Sorry.
They're it must be federal because it's across the whole country. So,
right,
but it is also mandated in our state Education Act that an IHP is written for students with chronic health issues.
Yeah. So, so the national position statement is that the registered professional school nurse, referred to as the school nurse, initiates and develops an individualized healthcare plan for students whose healthcare needs require more complex school nursing services. An IHP is a plan of care written by the registered nurse. So remember that it has to be written by the registered nurse for students with or at risk for physical or mental health needs. It is the responsibility of the school nurse to annually evaluate the IHP, as well as to update the plan if deemed appropriate to reflect changes in the student's healthcare needs and address nursing interventions and or student healthcare outcomes. And on this slide, I've also given the link to the full position statement because they have rationales and everything that go with it. And when I send out the PDF, you guys will be able to go to the website and read through that and rationale and everything. And so Beverly, let's talk about what you had just said with the state mandated IEP, IHP. Mm-hmm. Can you go back to that one more time, just to make sure everybody heard what you said?
Well, it is a standard that across the state and I'm sure across the nation, because every state school nurse organization, which is how I'm familiar with it, mandates the IHPs, and I know NASN mandates it. And then I know in our district, we've had an incident where the state asked us to provide our health plan, our IHP, in consideration for the complaint that a parent was registering. They knew to ask for it, and they they wanted to know what our standards were for writing IHPs and for discussing them with parents in that particular incident. But that, so that's how I'm familiar with it, is just in the being asked by the state of Oklahoma for the IHP we had written.
Okay, thank you. So we're talking about, like Beverly said, the IHPs and the standard. So we're wanting to create a safe environment for our students, and standard of care is for those students to have a health plan if it is medically necessary for them to have one. As far as the state of Oklahoma, we do have that standard of care. I wanted to really point out to you guys, there is one school health state law that does specifically say we have to have a health plan for them, and that is the Seizure Safe Schools Act. I'm going to click on that so you guys can see. And it's, oh, I'm going to pop up on the wrong screen. Hold on, here we go. So if we're looking at this Seizure Act, which also talks about training, that one person per building does have to be trained. And that was an act began January 1st of 2022. It also states in here that every student with seizures is supposed to have an individualized health plan. So I wanted you guys to see that, because this is becoming more and more common in state laws as we're passing more things. So right now in Oklahoma, if you have a student with seizures, they better have an individualized health plan, because it is required by law. Everything else is a standard of care, and we should be making health plans for every single other medically necessary student. But just to know that this is state law for seizure students as well. So I just wanted to point that out. And then we also fall on the Nurse Practice Act as well. So just wanted to put those there.
Kelly, can I just jump in there real quick before you go on?
Yeah.
And I think the driving factor, as I was indicating, is parents are now aware of the services that their child, especially medically fragile students and children with chronic diseases, those parents work in groups, and they know what the standards are, and they know what their child should get. And they're the ones driving a lot of this information and requests for communication. Who's going to do what? When is this going to happen? How can I know if it was done or not? And so that drives a lot of our responses in either an action plan or an IHP.
Yeah, correct. And I will say, where we're sitting right now, there is a big push for more parent involvement. So just being aware of that as well. You want to make sure that you're doing everything that you can to communicate with not only your staff, but also with parents, and make sure that we have all of these things put in place in order for best care, liability, everything else that goes along with that.
Right.
Yeah. All right, Beverly, I'm going to let you take over with the IHP and the kind of digging into what you want to dig into with that.
I'm going to jump down here to this IHP process, if y'all can see that come up.
Hold on, sorry. There we go.
There you go. Can you make that a little bit bigger?
Yes.
So people can read it, and so I can read it.
Yeah. It's hiding here behind. There we go. Is that better?
Okay, so we've got a question here. We might as well address that in the chat before we get into this process of what is required if the parent or caregiver does not provide the medical documentation or proper medication order. Yeah, that's kind of that's a big thing, isn't it?
Mm-hmm. So, I mean, it is required for the parent to provide those things and provide proper medication orders. If those are not provided, it's basically communication of, we cannot provide care to your student in school if we do not have that paperwork in place. Which kind of sound like a jerk saying that, but the options are, you as a parent can come up here and provide those services for your student, or we can call emergency medical services to provide those services for that student if we have to. But we as nurses cannot do nursing care without doctor's authorization. Beverly, you want to add to that?
Yeah, and then I always feel like such a jerk just being that we can't, we won't. I just do everything possible to help that parent. Can you get your SPED department to sign a release of information so that you can call the doctor, so that you can ask the doctor to fix the thing? Can you get that? Can you get that parent into your office on some sort of a collaborative relationship and say, well, how are you doing this at home? And how can I do this at school? The more that you can, my famous saying is, you kill more flies with honey than you do a fly swatter. If you, whatever you can do, I know I've been there. It's so frustrating when you've asked and they say they will, and they still don't. And you're trying to get it going, and you're supposed to, and they're still not getting what you need, and the frustration just takes over. And when I get to that point, I just say, okay, what do I need to do to build this relationship so that I can get what I need? And that's hard. I won't say that that's easy at all, but that's going to always be my second response after I'm done being irritated.
Yeah, and I will say I'm with you on that as well. You do what I can to be nice and be accommodating to help those parents in order to get that student what they need. But also realize with an IEP and a 504, we can't complete those or sign those until we have medical documentation from doctors either. So it's in the same space. So, if you have, say, it's one of your spec ed kids and that teacher for that kiddo has built a good bond with that parent, work with that teacher to talk to those parents and get that information that you need. Work with the counselor, whoever, can build those ties or those bonds with those parents. Do what you can in a nice way in order to be able to get those things. So I agree completely.
Go out and meet them at the bus stop. Whatever it is that I've had to do, I've done it. All right, well, let's just go over this real quick, because I think the question always is, I don't know how do I write a health plan? I don't know how to write one that's meaningful. And I found this process, I think it's from the Texas School Nurse Organization. Is that right, Kelly?
I think you're right.
Basically just saying who needs a health plan and how do you get it done? So, the first thing is identifying in your school who the students are that need a health plan. And I would start small. If I were just doing this for the first time, I would look at my diabetics. I would look at my fragile medical kids that we're taking care of. I would look at probably some asthmatic kids. Not all asthmatic kids need an IHP. An action plan is enough for them. But some asthmatic kids that forget to take their inhaler before they go to the gym every day or PE class, and just kind of identify who are the students in your environment that are at risk of their health needs being unidentified while they're out in the school building away from your clinic. Because remember that this health plan is not just for us. We know what we're doing, but it's to teach others what they need to know. So we're going to teach the TPE teacher that this student is going to come take their inhaler before they come. And then I'm going to have that conversation with the PE teacher to ask, so did Emily come and take her medicine today? So we're setting up those prompts and supports in place that student would be getting the care they need. So you just start small. Don't feel like, especially at this point in time, if you're not writing IHPs, or if your IHPs are just ramping up, really identify those that need communication of their health needs across the school environment. And then how do you find out about these students? What's the process at your school? You know, for us, we get information from parents on Power School at enrollment, and our nurses go through that, and we run a report, so we know how many diabetics we have, we know how many asthma, but there's always that surprise. And then there's always the surprise where the teacher says, oh, did you know we have a new student coming that is in a wheelchair? No, no one's told me yet. So working on that process, working on that communication will help define and build those relationships so that they remember to include the nurse. And then Kelly, can you go down just a little bit on that document? Developing the health plan. Again, not every student needs a health plan, but if you are going to be sending a student out with health issues into the education environment that's going to need support, or that people are going to have to know to recognize a need or send a student at a certain time, or to be able to evaluate how they respond when they come back, then or to remember to send the student. The famous one is, I don't always do a health plan on every diabetic depending on their needs and all that, but if they are going to come with a glucose monitor and I'm going to be monitoring that glucose on an iPad in my clinic, I definitely want a health IHP for that, because I want to say that I'm going to monitor that during school days only. I'm not going to be monitoring it when they're on the playground because it doesn't read. And I'm going to make sure that if someone was calling me, I'm going to get ahead of that. And I want to put all those circumstances into that IHP so that it's documented, so and I can get the parent to sign that, and I can cover my legal boundaries of that situation. I know that's a big hot topic, and for school nurses right now is monitoring blood sugars in the clinic office. So I just wanted to mention that briefly. And then how are you going to assess the students' health conditions? And lots of different examples are included in this data, in this document. You can kind of look at that. For most of us, if we've been doing it a while, we know that these are the assessments that we need. If depending on what we expect, if we expect this child to start self-cathing, then I'm going to have a procedure from beginning, I'm doing it for them, to identifying sterile process or clean technique, and I'm going to have where the kit is going to be kept. I'm going to know the dates, the times, all that stuff that we know, but that we're teaching the parents, we're teaching the student, we're teaching the teachers in the classroom environment. And is there?
Can I pause for a second?
Absolutely, yes.
Yeah, so whenever we're talking about identifying the individualized healthcare plan, I just want to reinstate every one of your seizure kids has to have an individualized healthcare plan. So that's a good place to start as well, because the law doesn't specify on what kind of seizures. It just says a student with seizures. So anyway, that's a good place to start, and then kind of go from there based on those needs. Anyway, go ahead.
And I also would add there that if you're using the Brendan McClarty Foundation asthma inhalers, that those students need to have, your asthma students should be considered as well to have an IHP, so that we know what orders we have. Okay, so then we're gonna go ahead and look at creating the question. I'm going to stop here and answer this question because I just saw it pop up here. Is, with a severe RN shortage, what is the deadline, expectation, prioritization of these IHPs for the bigger picture of everything going on the school day, and who are we held accountable to? I would say, I hear you, girl. That's what I would say, that there is never enough time, and it is something that we're preaching to the choir about, and we know that you all are working so hard, and that this is just one more thing. Let me just say this, that if we were working in the hospital or a clinic environment, that patient's plan of care would be really necessary, because we'd be changing shifts, and the next person coming on would need to know that information, and it wouldn't be if we had time to do that, it would be those things that when we're leaving, or when we're changing shifts, or when this student leaves our care in the health clinic environment and they go out into the teaching environment, then it's important. It's necessary. It's a liability, that when they go out into the clinic. So making it short, making it sweet, making it prioritized. And then the other thing is, once you get used to having some examples and some standards to work on, really a good IHP, probably 30 minutes during a school day. I mean, I never have time to work on it from start to finish, but during the day, in between taking care of kids and between giving medications, I'm continually going back to personalize, because we have so many standards that we can start from. Shouldn't be a long process. And I would encourage you, if you're concerned about getting it going and getting it started, to look at adopting some standard plans and then just personalizing them.
And I want to add in too, I mean, just like if you were on a floor at a hospital, you have to prioritize your patients, right? So I always start with the most severe kids. That way I'm getting their IHPs done. It's out to teachers so they know what they need to do during the school day. And then I go down from there. So if I have a kid who is, has a seizure disorder, and I know that at least once a month, they're probably going to have a seizure based on doctor's orders, that's one of the first IHPs I'm going to be writing up, so that the staff and teachers are aware this is a possibility that this could happen. This is what we need to do if this were to happen. Now, whereas like Cheyenne was just talking about, I have a ton of parents that mark asthma on their child. Well, again, we're going to prioritize what are our most severe asthma kids to what are our kids that never come with an inhaler, never come to my office with breathing issues, but they've been diagnosed with asthma. So we've got to, in that nursing process, prioritize those things. So if I have a student who mom comes up and brings an inhaler, we have an asthma action plan going on. Depending on her reporting or dad's reporting, would depend on if I write up an IHP, or if I have a student who I didn't think was going to be somebody that, like asthma student that was having issues, and I'm seeing them once or twice a week. I think maybe I'm going to write up an IHP so we can have a plan together for that student moving forward for the staff. So it's just, sitting down and prioritizing those things and then getting them out as you can.
And not every child that has asthma is going to need an IHP, but they all should be notified somehow. I don't know how you all do it in your schools. At Jings, we notify it with the health caduceus on the PowerSchool record, and that we put that there. And if that's all the parent has told me, that they have asthma and that's all I know, then that's all they get. But if they're bringing a seizure action plan to my office and the student is coming even once from PE because they can't breathe because they forgot to take their inhaler before going to PE, then I know we have a problem. Then I start working on the IHP process. So Kelly and I spent a couple of minutes yesterday just saying, we don't want to create more work for the nurses. This is not our goal, but certainly setting a standard of care and recognizing that we will be asked for this. Now, the question was, who am I accountable to? Well, I can tell you, like I said, I did have one example a few years back where the state of education, the parent complained to the state about not receiving the care that they needed. And the state of education came back and asked us, what were we doing? Where were our IHPs, and asked for the IHPs on this student. So that was the hard way to find out that we needed to be writing these IHPs. And the other thing that happens pretty often is that there's an incident that the student has somewhere in the environment, and then the parent is angry or the teacher is angry because they didn't know that this student Or a lot of times what would happen, they were getting ready to go on a field trip, and then at the last minute I'm showing up saying, well, don't forget we got this and this and this. Well, they didn't know. And so all those kinds of situations are where we get held accountable. And if whoever is doing your school nurse evaluation, if that person is using the state school nurse evaluation tool, it will ask on that tool about your participation in IHPs as well. Unfortunately, many school nurses don't get evaluated by other nurses or by people who use that tool. And so we have to really think about what the needs are, protecting ourselves before it happens. But if you do work in a larger organization where there's a nurse doing your evaluations, that should be part of your annual evaluation.
Yeah, and I'm going to say, going back to what we were talking about, alerting teachers of like asthma, one of the things that I always did at the beginning of the school year, aside from my IHPs, is I would have I had like an Excel spreadsheet list that I'm going to report off the PowerSchool that just listed all my medical concerns, all my food allergy concerns, all my, special consideration concerns. And I would break it up into teachers to like, who is this student, who is this student, who is this student. And I would make sure that they at least were aware that the parents have reported that this student had this condition. And then I would also let them know that I'm going to be looking into this a little bit deeper. If I don't have paperwork, then I will be contacting parents to see what else we need to know or what else we need to get into play. But just to give them a heads up, hey, this student has this, so that you're aware. I have more paperwork to come. So that was another thing I like to do for my schools as well.
And sometimes that's just an email that's an email at the moment I'm thinking about it and off it goes. I want to take a question here from Ashlyn. If a student's having syncope and seizure-like episodes but have not received documentation or diagnosis, what would be the best step to developing an IHP? Kelly Gorton, I see that you're on this meeting. If you're listening in, could you unmute yourself and address this question? Tell them what we did recently. I think she's coming in. Hold on here, folks. We just had this situation this last week at Jenks Public Schools. Kelly, are you there? There she is. Can't hear you. Can anybody else hear her?
No.
Okay. Are you there now, Kelly?
She says she's talking.
Oh, I'm so sorry, Kelly.
Oh no.
All right, well, I'll go ahead. I'm sorry, Kelly. We can't hear you. You're talking away. I'm sorry. I'll go ahead, but don't go anywhere, because I want you to meet superstar nurse Kelly Gorton. She actually had this situation last week at the high school with a big student, and the concern was safety and kinds of things, and not being able to get documentation. And here she had really the perfect example of doing whatever it takes to get those orders. She called the mom and asked if she could call the doctor's office themselves and get the information that the mom couldn't get. And the mom agreed. So then they got the SPED department involved and they signed all the paperwork. And then Kelly actually, can you talk now? Try again. No. I know, I'm so sorry. Kelly actually then got the paperwork signed with the SPED department, got permission, started calling the doctors and the ER, because the child had 2 ER visits, and finally got the doctor's orders that she needed, and then a diagnosis, and then started making phone calls for a neurologist or a pediatrician to see this child so that they could be referred to a neurologist, and really went above and beyond everything that she could do to get that information. And in the end, what we decided is that she would write a IHP for seizure-like symptoms and focus on the safety of the child, recognition of the symptoms, accommodating the child in unsupervised environments, and being prepared to call for seizure support from the nursing staff, and developed really an excellent care plan, not necessarily for seizures, but for safety. And so I'm sorry that she can't tell you more about her experiences, but maybe she can put, do you have a copy of your IHP you could share in the chat, Kelly? She might be able to share something like that with you, because she really did a great job navigating that situation. And involuntary muscle movements is exactly, they didn't know if it was pseudo seizures or involuntary muscle movements or psychiatric or neurological. We still don't know as far as I'm aware, but working toward that diagnosis. All right, so I think we're ready then to go ahead and implement a healthcare plan, right, Kelly? Are we ready to go to the next screen?
Yep.
And then evaluate. And obviously, I won't say much about evaluation because we generally do that once a year, unless things are changing and the student's situation is progressing or deteriorating.
You want to go to your example?
IHP example. Yeah, I can do that. Can you? It's not coming up. You'll have to bring. You'll have to do it because it's not linking for me. There you go.
There you go.
All right. This is just this. I always hesitate to share any IHPs that we use. We being Jenks Public Schools do use an electronic health record, and so our individual health plans are created for us. That's what I mean. If you don't have a EHR that creates a health plan, you might consider looking at the templates on the that Kelly Carter has provided, and you might consider even just a plain old book and just of templates and then just writing them in there. Now, a lot of people do it a little bit differently, but this is just the way that we've done it. Kelly, can you go ahead and I've hopefully eliminated all identifying information, but go ahead, stop for a second. We do, put our assessments in just because that's part of our EHR. We do use nursing diagnoses. I know that NASN does and consider that a health plan includes nursing diagnoses. I don't make a big deal of it. They're there, so I use them. And then we go toward specific goals that are important for this student. That they're going to be able to monitor situations where they need to seek help, that they're going to have to monitor blood sugars and all of that. And then our health plans list what we're going to do, who will do it, when we're going to do it, and then occasionally a why. I don't always fill those in. If it's something that I need for to explain to a parent, explain to a teacher why this needs to be done. But if not, then I kind of just, again, I don't want to make work for nurses. I'm all about getting the information that we need to the right people, using water and restrooms, and that we're going to test and treat prior to physical activity and academic testing, and riding the bus home, so that the teachers need to know that they need to send to me before they dismiss. And then using our carbohydrate list, that the nurse and the health assistant will assist in doing that, that all staff need to know about the hypoglycemia algorithm, and that the teachers are required to do their diabetic testing. This student was a new diagnosis, so I put a date on there that they needed to complete it within a few days. And then I did send out a hyperglycemia algorithm awareness sheet for all the teachers as well. Field trips and parents to tell us about changes to the medication. This is one of those that, good luck, I will have to usually the student will tell me, and then I'll have to call the parent and say, oh, there was a change, and is it okay if I contact your endo? So, but again, I'm doing it for the student as well. This was a brand new diabetic who showed up on a Tuesday morning after having been in the hospital for 5 days, and then came back to school with no orders and no supplies. And we really had to go commando on getting the information we need and going and just doing whatever it took to get it done. And then we do have the parent sign it, we do have the nurse sign it, we do have the teacher sign it, and there's a place there to have the student agree to sign it as well. Now, again, we kind of use our judgment on how many we need those, but if I'm going to be doing something different that the parent needs to know about, or in this case, she didn't have a blood glucose monitor, so I didn't ask the parent to sign that, and I took all that information off anyway. And then the parent also signs the bottom that they understand what school health services are being provided. So that's just the example of how our IHP generates a health plan. And like I say, this probably took me, it's pretty standard. I have this on a template. It's pretty standard. It was different because this child showed up without any orders. I had to kind of narrow it down, but it can be done. Once you get in the habit and you have those examples handy, they can be done pretty quickly.
Yeah, and as well, once you have a student that's on an IHP, you can, like that next year, make edits to that IHP to move forward for the next year. Just make a copy, start a new year. If nothing has changed, it can stay the same. So once you create these, really and truly, that first year is going to be the hardest. But then after that, it gets a little bit lighter and a little bit easier in order to be able to do these, I promise.
Want to take some of these chats?
Yeah, that's what I was thinking.
Okay.
I'm going to go back to Brandy. Brandy said we have a parent state that they wanted a seizure plan because their child was having seizures, but the note from neurology states that the child has no seizure history or activity. What do we do in that situation?
That's exactly the situation Kelly Gorton and I faced last week. They were saying it did not look like seizures. And so again, well, we went, go the path of least resistance and the path of most support for your student and your parents, because that's what administration is going to do anyway. And it's true that it is a safety issue, whether it's from a neurological issue, or it's a seizure, or it's psychological, or it's physiological, like low blood sugar. It doesn't matter. We need to provide safety for that student. That's what I would do.
Yeah, and I mean, I think too, in that situation, there's a lot of times when I will put in parent reports and then just kind of put in the details, and then parent reports this, and this is what we need to be watching for. We could do stuff like that as well. It's not ideal, but it's in order to be able to meet that need, because sometimes the need is the parent and sometimes it's the physician. We can make those things work.
Mm-hmm.
Another question, I think Kelly asked it, or Cheyenne asked if Kelly would share that example, the IHP that she wrote up for that student that you guys have, Beverly. And then Brandy writes, school wants to support parent, RN wants to support doctor. Note, what do you do? Brandy, can you come off mic and elaborate on what you're talking about?
I think that was okay.
There you are. Yep, we can hear you.
Okay. I had accidentally hit enter when I was typing up, and so that's why it kind of cut up my message into two pieces, and I'm sorry about that. So it was kind of an extensive situation where the parent states that the student was failing a specific class because the student was having seizures in class and passing out, although it wasn't witnessed by a teacher or anybody else that this was happening. So the parent went to neurology, did the appointment, they did the EEG. The parent brought documentation. It was very plain that it was not seizure activity, but yet the parent was insistent that we were writing into the student's IEP that they had seizures and that we needed to excuse work when they had seizures during class.
Mm.
So it was a real sticky situation because we were happy to support the student if these events were happening, but we didn't know how to do it in a way that was making sense.
I mean,
To write a seizure plan for somebody that's not having any witness seizures that are being treated by anybody on staff to support grades and passing and education at the high school level where
Right.
credits count. I mean, it was hard.
I think Brandy, on that one where there's an IEP involved, like from my understanding, you cannot write that into an IEP without a physician's order at all. So, so I think that's a little more clean cut, just because there's so many specifics what you can and cannot do with IEPs and 504s.
That falls back on the special education team then. That's
Yep.
not in there. It's the team that when the team evaluates the IEP, your SPED coordinator should get the necessary information and releases.
And
Yeah.
that's what we had done. It had come back on the nurse as well. The nurse needs to notify the staff to watch for seizure activity, which was fine. That was easy, but I had a hard time signing off that the student needed the seizure diagnosis with a doctor's note from pediatric neurology that said the student didn't have seizures.
Right. And I think that's where that goes back. I'm not necessarily saying you build a health plan based on what a parent states, but you can create an alert. So
Yes.
if I have a parent who's stating that this kid has seizure activities and I do not have a doctor's note to support it, we can put in parent states seizure activity. Doctor's note on file does not support, or I mean, I don't know if I'd say that to teachers, maybe seizure-like activity or something to that effect. So I can still report it, but then also knowing that I don't have doctor documentation. So sorry, my phone's ringing. That I don't have doctor's documentation to back that up. So we just are aware of it as a possibility, but it's not a fact until I actually have those doctor's orders in hand.
Yeah. Thank you.
Mm-hmm. I'm going to share that health plan from Kelly with everybody. So, so does that clear that up, guys? As far as that health plan work? Okay. Then Jessica writes, we have a student having seizures almost every day, have asked for doctor's documentation multiple times over multiple years, still no doctor's documentation. We've created an IHP for her for seizure-like activity. So I get, our procedure is to call 911 for any seizures that are not documented by physician. Parents wants us to call 911, and I have said, no, not until we have documentation from the physician. I think, let me go back up to Cheyenne had asked about DMMP stuff too, because I think this all falls kind of in that same line. Let me read through that really quick. So, okay, here's where I'm at with a lot of these things. So Cheyenne had asked about like, a student coming in with the DMMP, but mom is not providing all the supplies that she needs for care. I'm going to hit this one first. And so, even after multiple asking, what do you do? This is where if I was having issues like that, if I came across something say on, I'm taking care of the student and according to DMMP, I'm supposed to give this amount of insulin, but I don't have that insulin to give. That's when I fall back and call that parent. Hey, the DMMP says I need to be doing this. I don't have the supplies. Can you bring them up, or would you like to, can you come up here and dose your student? Because I can't without those supplies. That's just one of the things that I've done in the past. If parent won't, again, we always have IMSA backup if we need it for situations like that. But if I don't have those supplies, and parents aren't providing, then I'm calling them every single time. Beverly, I don't know if that's similar to what you would do.
Yeah, I do. And then after a while you go, well, why is this happening? And you, well, how come I've been asking for this and they're not sharing it? I guess I'm always the kind of person that says, well, why? How come? Why? And I just think that a lot of things get dropped with, well, they just don't, so I won't. And I don't think that, especially in these circumstances, that's not how I would practice. That's not how I want to practice. I would say, well, why? What is it that do they not trust me? Therefore, I need to build trust. Do they not have the things and it's costing them so they can't afford to give me extra supplies? Do they not have they not done what the doctor said, and so they don't want me to know that? So I'd kind of think, well, why? And then I'd get right back into that relationship building. I'd be calling, I'd be saying, I'd be looking, I'd be trying to, I want to help you, I want to help your student. And I'm not sure what you're doing at home, but how can I get this? And I getting permission to call the endo, maybe the Diabetes Association could provide me some sample supplies for the things that I needed at school. I make sure that my administration knows this is happening. I make sure that I'm sure the principal probably knows if this person isn't compliant with the nurse, they're probably not compliant with other things either. But I'd make sure that my principal knows it. I'd make sure that my assistant director of health services knows it. I'd make sure that my director of health services knows it. And I would take it up the chain until we were able to get what we needed. I think most of the time it's just so exhausting, and I get that. And these are always the most difficult people to deal with. And they're always the ones that make me the maddest. And they're always the ones that just try my patience. But I go, well, why? There's a reason behind every behavior. So why are they not doing this? And if I can't take care of their child at school, what do they expect?
Yeah, and I want to reiterate. I know I'm sitting here saying you just keep calling the parent, keep calling the parent. I would reiterate what Beverly said. Building that bond and that trust with that parent is paramount to be able to care for their child. I don't call and just be like, hey, I need this thing, or I can't take care of them. That's not the way I approach it either. I will call and say, hey, we need these things to take care of this student. I know you guys are super busy. What can I do to help you so that we can make sure we're doing the best we can for your student, for your child? Just, whatever that verbiage is, take out the you and put in the me. So what can I do to help you? What are some things that we could do together to work together in order to be able to care for your child? Put it all back on you, instead of saying, you need to do this, you need to do this, you need to do this. And that's if saying those things causes a parent to be very defensive, just naturally. So take it off of them and put it on yourself, put on your nice nurse voice, and do whatever you can to get the things that you need to be able to take care of that student properly. So anyway, I just wanted to say, I don't just call and say, I put a checklist out and say, I need this, and this, like I've called 20 times and you're still not providing, like that. You're not going to get that response you want. I promise. So what can we do? Can I bring in the counselor to help us discuss like some options that we can sit down and talk about, like whatever it is, like, help them. And again, like Beverly said, it's exhausting, but sometimes that's what we have to do in order to be able to get the things that we need to take care of our students the best. I'm going to go back to the seizure question that Jessica posted. We might go over time a little bit, guys. Sorry, I apologize, but I think this is really awesome discussion that we're having. We have a student who has seizures almost every day. They created an IHP for seizure-like activity. The procedure is to call 911 since they don't have documentation. So that's their, I'm assuming, school procedure, policy and procedure. If the parents don't want them to call 911, and I have said that we can't do that until we get some physician documentation. Yeah, I would fall back on policy on that one. Again, being super nice about things, but just letting them know, I don't have any physician's documentation specifically that says not to call 911. Our policy here in district is if a student has seizure activity, we automatically call 911 or whatever your policy and procedure is at your school. Just be really open about that. I love falling back on policy and state law. It's my favorite because there's not a whole lot of arguing they can do with that. And maybe eventually, if it happens multiple times, maybe they'll be willing to provide that documentation for you. But you use that in a nice way. Use that to your advantage whenever it comes to those policies and procedures. Beverly, you want to add in?
I think you did a great job.
Thank you. Another question. With one of my diabetics, I have emergency supplies, but parents prefer that backup pump supplies and extra that they keep at home due to cost, which I totally understand that. It is written in an IHP that parents request this and agree to be available to come to school and change out the pump if that arises or whatever the situation is. I think that, Brooke, I think that's a great compromise. If it's because of cost that we only have one vial and we have to use it at home, and if we run out, if they're willing to come up and like redose, awesome, use that. That'd be great. So I like that as an option. And Laura, thank you. I'm glad this has been helpful. And we're going to send out, I think there was there's one other thing that I want to go over real quick, just as a tool for you guys to utilize. I want to say this does not replace your IHP whatsoever. This is just another tool that Gail and I created as kind of a teacher summary to complement your health plans. If you have not been doing health plans and you're just like, okay, next year we're going to start doing health plans, do those. Like, that's what you need to concentrate on. For those of you who kind of like, this is what we've been doing, but the teachers don't really pay attention to it, we created what I call an IHP summary template that kind of gives the basics of the disease process that this student has, kind of some of the common symptoms of the disease process, and for you to be able to add in accommodations at the bottom. Again, this does not replace the health plan. It just is another tool for you guys to utilize if you would like. So I'm going to just share where that is. And I think I've sent this out. Come on. I've sent this out before, but I want you guys to know. And then I really wanted to reiterate, that's not what I wanted. Well, that's not it. I will fix that link. Okay. And again, I just want to reiterate that it does not replace the IHP. It's just another tool for you guys to use. And then I don't think we're gonna have time to get to action plans today. So we will probably tackle that on another call. I want to do, let Beverly say a few more things. If we want to do a few more questions, we can do that, but kind of wrap up. Beverly, go ahead.
I'm not going to go ahead and show them there, but I just wanted to, know that we did put in some templates for you. The OSDH has some IHP templates for basic conditions. There are a ton of them. Texas School Nurse Organization is just awesome at sharing their information. So I did include their templates there. And then if you don't have templates for something that you're looking for, the Nursing Diagnosis Essential Guide to IHPs, that's a great book reference. It's expensive, but if you bought one for your district, it might be a good start. And then just share. I mean, if you need one, ask me, ask Kelly Gordon, ask Brooke Begwin from, I am retiring June 2nd, but we are happy to share our templates from our EHR, and not saying that they're better than anything else, because there's two different formats and you use the one that makes the most sense to you. We use the one that's easiest. And this comes off of our EHR. So, but share them and don't feel judged. Somebody may want something different, and that's okay. But just how we do it or how you do it, we all can work together and take the best of the best ideas.
Yeah, I want to show them, now that you said that, about that book. Bev and I found this website yesterday that looks really, really good for finding nursing diagnoses. Hold on, let me get it pulled up here. There's a lot to it, but you can, let me go back up to the top. It's called Nurse Lab. So it's Nursing Diagnosis, the Essential Guide. They have a table of contents here. So if you want to read through all that, more than welcome to. But if you go here to the Nursing Diagnosis for Care Plans, you can kind of pick on, let's say, where's one that would be like risk for falls. So if I have a student who has seizures, this could be one of my nursing diagnoses, risk for falls. So it kind of goes through and says, whose risk factors, the desired outcomes, your assessment and rationales for those different things. And it just kind of gives you just like, you can pull out different things out of here, just like you would out of the book. There's interventions and rationale. So it's a really fun little resource that we found yesterday that I would encourage you guys to look through as you're starting to build your IHPs as well. So, okay, I am going to, I have like 2 things open here. I'm going to stop sharing my screen. So we are going to not only will send out this recording of this video, we will also send out the PowerPoint slides. I'll put them on a PDF, but all the links will be usable so that you guys can use all the resources that we sent out. I think we have a few more questions and we're going to wrap up, but you guys, if you have any more questions that you think of later on, feel free to email me or Beverly at any time. Gail is also available for email, and we will not mind jumping in and helping you out at all.
I want to address Peggy Kane asked a question because she had to go about IHPs in addition to the emergency plans and doctors to sign both. Yeah, we did cover that. So if you look back through the video, but the short answer to that is no. If you have an emergency plan and that's all that is needed, and you're not going to be teaching the students or the teachers and the PE teachers and the music teacher and the bus drivers and the healthcare, you're not going to be doing anything else with that, then the action plan is enough. If you are going to be expecting recognition and teaching from the student in the classroom or in other school related activities or situations like field trips, if you're going to be planning for that, then you need an IHP. And the doctor does not need to sign. The doctor usually generates orders like the DMMP, and usually with the action plans, we just have the parents sign it. And the IHP, I like the parents to sign it for liability reasons.
Yes. Cheyenne asked, does anyone have a consent form for release for medical records? I don't have one specifically in hand.
That should be a district specific consent form, because it's not just for you. They have to get all kinds of things for their IEPs, and that should be a district form.
Yeah, talk to your spec ed department, or admin, because they should have those available for you guys. All right, I think we've answered most everybody. So yeah, so I know that was a lot of information, and I'm sure there's so many more questions and answers that we could go over whenever it comes to health plans and
long seminar and
huh? What'd you say, Beverly?
And we just did a whole day-long seminar in 1 hour.
Right.
And we didn't do a very good job of it because there's a lot more that we could have helped you with, but give us a call.
It's a start. So so that's where we're at. For those of you who are feeling overwhelmed by the thought of health plans, it's one at a time. Take one health plan at a time. Don't look at the big picture of, I have 500 to do. Let's not do that. Let's tackle number 1 and go from there. I promise the more you do, the easier it gets. And the more, the better, I want to say better standard of care that your students will get across the board whenever you have these things in place at your schools. So reach out. Again, we're here if you need anything. I appreciate you guys attending these month to month. Just so you know, I am going to continue them through the summer. I know you guys aren't working, but I still want to be available to you guys to bring a few things before school starts. So we'll have one in June and in July, and hopefully I'll be tackling a few beginning of the year school things that we're going to do. Also, the School Nurse Summit is in August, and we actually have reached max capacity of how many people we can have to attend. So we have created a wait list, which that email should have gone out like 10 minutes ago. If you guys did not sign up to come to the conference, sign up for the wait list. And if people cancel, then we'll get people in as they sign up. So anyway, reach out. It's great to see you guys. Happy, I forgot to say happy School Nurse Day. I'm
School nurses, yay, congratulations. We love you guys.
Right, we really do. We love what you guys do. We love that you care for your students, and we appreciate every single one of you 100%. So continue to do what you're doing, and know that you are supported and backed, and we're here for you. So thank you, and we will see you next month. Bye, guys. Thank you, Beverly.
Thank you.